Good morning to you. It is Thursday, December 9th. Welcome to the Morning Medical Update. Thank you for joining us here on Facebook and also on our YouTube channel. Coming up today, check out these pills. We want to show these to you because they may look normal, but these are counterfeit pills. They are laced with fentanyl. Take just one and you could overdose. In fact, the Missouri Health Dept says in Kansas City alone, opioid overdose-related deaths increased 56% in 2020. Now, there is a treatment for opioid addiction, a game changer, a lifesaver for many. Today, we talked to the first patient to try it here at the health system and find out how he's doing now. Plus, what is being done to combat this growing epidemic? So please make sure to get your questions sent in to us on YouTube, Facebook. You can email them to the Medical News Network. Those links are right there on your screen. But first, Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, joins us with the numbers. Any changes? Any good news?
It's about the same. I guess that's good news, is that it's not going up. But I think, again, we know the surge in cases that was occurring 2, 3, 4 weeks ago, we have to expect hospitalizations to go up. But right now we have 36 active infections, 9 in the ICU, and 7 of those on the ventilator. We still have 24 meeting that additional criteria for recovery. So total of 60, but again, 36 active infections. We did have our last inpatient death from COVID on December 8th as well. So we are still seeing hospitalizations. We are still seeing deaths from this.
All right, let's see if there's any reporter questions on the line for us today. None so far. All right, we're going to get to our viewer questions here in just a bit. As always, the opioid battle is all too familiar in the Metro Sheriff's Department. In fact, they are holding summits for parents to inform them about what is going on. According to the Clay County Sheriff's Office, they have had 12 opioid overdoses this year from counterfeit pills containing fentanyl. Some of those were children, and in those cases, 9 people died, and the numbers are actually much higher than that. We're going to talk about that here in just a moment. So what is the solution? One man who spent years seeking opioid pills on the streets found a solution right here at the University of Kansas Health System. He was the first here to receive a treatment called Sublocade. We first brought you Clint's story in March when he was taking it day by day.
I blew through a lot of money and saving my savings, and I wasn't a good employee. I wasn't a good boyfriend. I wasn't a good, anything really.
Nearly 20 years of opioid addiction was taking its toll on 38-year-old Clint Adams. He became addicted after breaking his ankle when he was 19. Prescribed medication eventually led him down a dark path.
You can buy these laced pills that are just terrible, and they're based with fentanyl, I believe. I don't really know. I was taking a risk just doing some street drug. I would crush them and snort them is where it got in the last few years.
Stints in rehab and medication helped some, but not long term.
At first, I think I was doing it just to please my family and my girlfriend, and I'd take it for a little bit, and then I'd stop taking it when I decided I wanted to get high, or that I thought I had control over my addiction. And it was just a cycle like that for years and years and years.
But a new option came in the form of a new medication and the way it's given to patients.
People who don't have time to go to the doctor every week or something like that, or professionals, it's a better option, I think.
It's called Sublocade, and Clint was the first patient to receive it at the University of Kansas Health System's Addiction Treatment Center. Sublocade continuously releases medicine into the body for a month at sustained levels without the daily ups and downs.
When you get to a certain point with opioids, all you do is you need to take them to not be sick and to be able to function in life. So it's more of a need than a want.
Now, on his second dose, Clint says he's starting to round the corner.
If you're a drug addict, like to where I was, you lie. Your whole life is built upon lies.
But not now. Clint is a proud 90 days sober and takes it one day at a time.
And I look forward to just gaining my family and my girlfriend and my friends' trust back. But yeah, it's working real well for me.
Love that story. Clint Adams is joining us this morning via Zoom to talk about how he is doing. We are also joined here in studio with Dr. Rupa Sethi. She is the director of opioid treatment program here, and also Dr. Stephen Thornton, medical director of the Poison Control Center, also an emergency medicine physician here at the health system. Great to see both of you. We're going to talk more here in just a moment, but also joining us via Zoom is Sergeant Gary Blackwell with the Clay County Sheriff's Office, who has seen enough opioid deaths in his county, that is for sure. And he's going to help shed some light on what they're doing and what can be done. But Clint, I do want to start with you first. Yes, we talked back in March. Thank you for sharing your story with us back then. How is your recovery going, my friend? Get us caught up.
It's going really well. Saturday, 2 days from now will be a year for me. I'm no longer on the Sublocade. I stopped it about 2 months ago, and I'm fine now. I'm still, working day by day, but it's been a year. So, I'm very pleased. I'm very happy, and things are starting to get back to normal in my life.
And when we talked, you were 90 days out, and I remember you were being optimistic, but you were saying, I just really want to take this day by day and try to show your family and friends that you can do this. Tell us a little bit about, though, how you physically have felt. We're going to talk to Dr. Sethi about what Sublocade is here in just one moment, but just tell me a little bit about where you were a year ago and where you are now and how you physically are feeling as far as the addiction feeling.
When you first start taking Sublocade, it's supposed to help with any cravings that you may have. And I didn't have a huge problem with cravings at all once I got on it. And then, as time goes by, they'll get less and less and less. Or, that's what the hope is, at least. And that's what it did for me. Honestly, there was no major side effects for me that would want me, keep me to not want to do it or feeling any differently. It's just, it's long lasting. You take the shot once a month, so you don't have to worry about not taking a dose or things like that. And I don't know exactly how quick it works, but it worked pretty fast for me. And like I said, I didn't have any side effects really. I didn't feel bad off of it or anything like that. And if there were any side effects, Dr. Sethi was, for the most part, able to, help me out and figure a way around it.
And we're showing pictures right now of you receiving that first Sublocade treatment here at the health system. So I do want to bring in Dr. Sethi just to tell us a little bit about what Sublocade is and how long this treatment has been around and how it's helping patients.
So Sublocade is a once-a-month buprenorphine injection that is available. It came out in 2017. Before that, in 2003, we had just the buprenorphine, the trade name of which is Suboxone, and it has been around there but it is a sublingual medication. And we didn't have as much success sometimes with it because people would stop using the medication and then relapse or miss an appointment, have cravings, have withdrawal symptoms, and relapse. And then in 2017, this injection came, and we got it here at University of Kansas Health System. And since then, we have seen that once we give the injection, it's got a 1 month period where the injection stays in your system.
So it releases?
It slowly releases. We give it in the tummy area or the abdomen area, and it's a subcutaneous injection. It's a liquid injection that then becomes a depot, and then it slowly releases from there over a month. Patients can get it every 26 days, and we have doses that we can give them. And it maintains a steady plasma state, which means that it slowly releases itself and doesn't go through ups and downs that a medication would go through. So it's really good because people have no cravings and less withdrawal symptoms, and they do really well.
And they're not missing those appointments, because I would imagine that is a big hurdle. Then you had a pandemic in it. How is the pandemic affecting patients and the work you're doing with these folks trying to get off opioids?
The pandemic has been very hard, but we moved to a lot of telehealth appointments, especially for the physicians and everybody. For the injections, the patient just had to come in, not see me, but just see the nurse, get the injection. The only time I need to see them if they had a side effect or if there was something that I needed to address. But we would see them every 3 to 4 months, and we would see them via a telehealth appointment and follow up with them of how they were doing.
So we're going to be talking about this opioid epidemic during a pandemic and the treatments that are available right now. So Dr. Thornton, I want to bring you in. You work in the emergency department as a physician. You're often the first line of defense when somebody comes in with an overdose. Tell us what you're seeing, what this last couple of years has been like.
Well, we were already kind of in an upward trend as far as overdoses were going before the pandemic, and the pandemic only accelerated all of that. And we're definitely seeing in the Kansas City area exponential growths in the number of opioid, particularly fentanyl, and the kind of synthetic opioid overdoses. Kansas City was never a huge heroin town, so to speak. I mean, I say that because you can go to some cities on the East Coast where there was just tons and tons of heroin, and folks were getting, overdosed every day, and hospitals would see tons and tons of those patients. We were kind of protected from that for a while, but that really changed, I'd say, 2, 3, 4 years ago, and now we're seeing, I think you talk to any hospitals in the city, and they're seeing overdoses daily. A lot of Narcan use, the medication that reverses opioid use, is being used a lot now. And so we've kind of caught up with the rest of the country in that sense, and we're dealing now with this fentanyl epidemic, this synthetic opioid epidemic, which is just so deadly because when you look at fentanyl, you're talking about a substance that's 100 times more potent than heroin. So it does not take very much, and fatal doses can be contained in those pills that you showed. And really, I'd say over the last year to year and a half, basically if someone is using an opioid, it's probably fentanyl. There's studies showing that people, even when they think they're not using fentanyl, they're using fentanyl. So
educate me then. If someone's on heroin, and Clint, maybe you can add to this, but if someone's on heroin, they're moving on to opioids and fentanyl as the next step?
Well, sometimes
because they can't get it.
Yeah, exactly. Sometimes we're seeing cases now where you just can't find heroin. Everything's been replaced with fentanyl. Fentanyl's cheaper to make, more potent. You can make more money off it. And so when you go, I've talked to those with substance use, opioid use disorders, and they can't find heroin. It's all these synthetic opioids, the fentanyl, these pills. Some of them are called Perk 30 sometimes, or M30s, and like I said, very, very potent. And really one of the really big dangers is that the way these pills are made, one pill may contain a small amount of fentanyl, and the next pill contains a whole bunch of fentanyl. And so someone could say, well, I'd always used one pill a day and I was fine. And this time, however, they run into the pill that has 10 times the amount that they used the day before. And so that's how these overdoses really happen.
So it's just dirty stuff that you're getting in your system. You're the director of the Poison Control Center. So it is poison to the body, Dr. Thornton.
Oh, yeah, absolutely.
What is happening in the body, and why does it affect some people to an overdose state, and somebody else can get by with it okay?
It all comes down to the dose, mm-hmm. And you have to remember that these pills look like pharmaceuticals, but there's no quality control. There's nobody measuring how much fentanyl is in each pill or anything of that nature. And like I said, it does not take very much, unfortunately, to overdose due to the potency of fentanyl.
Clint, what could you add to this? What were you hearing when you were, I know you'd said you were kind of out there, sneaking away from work and friends and family to try to catch this stuff. What were you hearing back then? What do you hear now?
I don't hear anything now. I stay away from that. But
good.
The M30s are the pills that took my addiction to a whole nother level. I would seek them out because I knew that they were stronger, and the same thing doctor said. Some of them would work really well, and some of them were, you would kind of black out. And I think I got lucky personally, but those are the pills that I knew were all over Kansas City.
So you weren't worried about what you were taking. You just wanted to take it. You were willing to take that risk, is what you were saying, because of the addiction.
At the time, absolutely, yeah.
So that's where Sublocade comes in.
Yes.
So has this been a game changer?
It has been, and Clint is one of our best examples for that. For years he had been on buprenorphine, and that was the sublingual form, but he would relapse at the end of the cycle before he would come for his appointment, and that's when the relapse would happen. Once we started Sublocade, what happened was he was on once-a-month injections, so there was a constant release throughout. So he didn't have those cravings, didn't have withdrawal symptoms, and hence no relapse. And in every 30 days, he would get his injection and then maintain sobriety.
So we know Clint's a good candidate for this type of treatment. Would anyone be a good candidate that has an addiction to opioids, heroin, anything?
Every person is different, and we have to decide whether methadone, buprenorphine, Sublocade, or Vivitrol would be an option. So those are the medications that are available out there. But depending on who is a good candidate for Sublocade is if they are on buprenorphine and want buprenorphine treatment, but are not able to maintain abstinence during that time, then they are actually a good candidate for being on Sublocade injections. Also, people who are working maybe and do not want to come in more frequently to get their medications might be a good candidate as well for this.
So let's talk about insurance. Is it covered through insurance?
It is mostly. Sometimes there is a copay. Also, the Sublocade program also gives a copay assistance card. We also have a grant through the state of Kansas here at University of Kansas Health System, and that grant also covers Sublocade for the uninsured and underinsured people who live in the state of Kansas.
The idea of this conversation, though, is to let people know that these type of treatments are available. And we hear from Sergeant Gary Blackwell in Clay County. I want to bring you in here, sir, and talk with us a little bit about 12 overdoses, but you say it's going to be much more than that. There were 9 deaths in Clay County. You say some of those overdoses involved children. I just want to hear a little bit of the landscape of what's going on down there, what you're hearing, where people are getting these drugs, and then we'll talk about how you guys are trying to fix it. Good morning to you.
Well, they're readily prevalent on the streets. Where they're getting them, once you take one out, once you take one supplier out, then someone else is going to come in and fill the void. The high-level dealers are paying $8 a piece for these, and the average price on the street is $30. So we're talking a $22 profit per tablet. So someone's going to step in to fill that void. The main overdose that we're seeing right now, or the primary demographic, is going to be between 15 and 25 right now is a lot of what we're seeing. I've talked to people. One person that I talked to was Narcan 5 times in the week prior to them actually being arrested. 5 times. And
tell folks
still
what that is and what that means.
Narcan is and the doctors can speak more to this, but it's a blocker that if someone is currently overdosing on opioids, then it's a nasal injected substance that officers carry, deputies carry. We actually came across, and then it's injected in the nostril. Sometimes it takes more than 1 dose to bring somebody back, and it'll bring somebody back and reverse it to the point where at least we can take them to the hospital and get treatment. I've talked to dealers who actually, when they sold these Perk 30s, if you bought so many Perk 30s, then you would get Narcan with it. It was kind of a one-stop shop. It's the only substance that I've ever known of that if somebody hears that their friend or somebody overdosed, then they want to know who their supplier was, not to steer away from that supplier, but to actually seek out that supplier because they know that they're selling strong Perk 30s.
They're handing out the good stuff, and you just really kind of put this all. You just really described this and put this all into focus. Even getting like a freebie of this Narcan when you buy enough drugs, because why? They want to keep you alive. They don't want you dead. They want you coming back for more. Dr. Thornton, come in on the conversation with that. Do you see that when people come into the emergency department? Do hospitals have access to this? Is that something they use?
Well, yeah. So when we're dealing with the opioid epidemic, there's different phases to approaching it, right? There's no one single solution. One obviously is education, making sure people know that the fentanyl's out there. Another is acute treatment, which is the Narcan, because otherwise people die. Mm-hmm. So the Narcan basically is an antidote. It reverses the fentanyl, whatever opioid they're on, and it saves that person's life. So that person can then have the opportunity to recover and see Dr. Sethi and get better. That's the final kind of piece of it. So Narcan is a very important component in dealing with the opioid epidemic. It basically gives people a second chance to get better and to get treatment.
But we don't want to rely on that as a treatment by any means.
Well, it's not a treatment in the sense
it just keeps your heart going.
Exactly. It doesn't treat the addiction. It basically saves your life, so you have an opportunity to get the addiction treated and to not have that happen again. But like he said, it can, people overdose all the time, and you can talk to some of these users and they'll say, oh yeah, I've been Narcan 5, 6, 7 times. It's just really not uncommon in the fentanyl era to overdose, because these people just don't know how much is in these pills, so they can't say, well, one pill is what will do it for me. It could be that one pill could be enough to kill them that day.
So where are the dealers getting these drugs? Help me with that, someone.
I mean, I think he could probably speak to this better than myself. But through the Poison Center, we've spoken to the FBI and other organizations. And as far as we know, it primarily was coming up from Mexico, but they're starting to see more and more homegrown fentanyl now, because fentanyl can be synthesized, and they're starting to see that as an issue. So there's probably two sources at this point, from down south and then basically locally grown fentanyl, so to speak.
So I kind of want to go over. Yeah, go please. Gary, go ahead.
That's something that we've been seeing, and I'm a member of I'm the supervisor of the Clay County Drug Task Force, but we're a member of what's called MOIN, and that's Missouri Western Interdiction and Narcotics Task Force, in which they do parcel interdiction, they do highway interdictions, and we're starting to see a large, and we've seen it for a while, a large amount of parcel interdictions coming from overseas, and then people are mixing acetaminophen and fentanyl, and it's people who have a pill press, and they're actually pressing these things locally here. There are some people that are doing that because the profit margin is much higher. And I equate them to, if you're making a batch of, and I equate it to this, if you're making a batch of chocolate chip cookies and you happen to get a cookie that's made from the batter that's down there on the bottom that happens to have 8 chocolate chips in a cookie size piece. So when you get that chocolate chip cookie, you're getting a lot of chocolate chip cookies. Well, there's no way of thoroughly mixing this fentanyl in with this acetaminophen outside of a laboratory and maintaining a steady recipe, if you will. And then where you got a lot of kids who, and like the doctor said, we got a lot of kids who take this, and we actually have one case where 2 girls split a pill in half, and each took half of the pill, and one girl was fine with absolutely no side effects whatsoever, no effects on her whatsoever, and the other girl died because she just happened to take the portion of the tablet that had all the fentanyl in it, and it's scary.
So I'm going to ask the $1 million question, and Gary, I'm going to start with you, and thank you for putting these in terms I can understand, and hopefully our viewers can understand as well. But how do we fix it? Where do we start? How do you start to fix something like this?
It's coming with, and I've talked to a lot of people, like Clint, who started off, getting hurt, and then eventually over time develop an addiction. This is something that family members need to watch for, parents need to watch for, friends need to watch for, and if you're seeing the signs, then you've got to say something. You've got to get in there, because it only takes one time, and they're gone. I've talked to too many parents. I've talked to too many friends. I've talked to too many relatives that said, I knew something was up. I didn't want to really breach that conversation line right there. And I wish that I would have. A true friend's going to tell you when you're messing up, and we've all got to be cognizant of observing the signs and what's happening, and do our best to get these people into treatment.
Clint, jump in. Were your friends telling you were messing up?
I mean, no, I tried to hide it from everybody as much as possible. My girlfriend she was the person that I was living with, so she could see the end results, but no, I pretty much tried to hide it as much as I possibly could from loved ones.
What were some of your lows? Tell me about that, because I want to hear, when we wrap up today, I want to hear about where you are as far as that goes today. But what were some of your lows when you say that it was affecting work, your relationships? Tell us about that.
Well, I really wouldn't, on the weekends or whenever, if I ran out of pills, I would just, sleep for days, and just wouldn't leave my house. And I wouldn't show up for things I was supposed to show up to. I would miss work, miss meetings, miss a lot of stuff. At the time, I worked away from the corporate office that I worked for, so I kind of got away with it for a long time. But yeah, just missing things that I shouldn't miss, sleeping when I didn't have drugs, and then my whole life and daily routine was just waking up and trying to, go out and find drugs to make myself feel better and keep the addiction going.
So what was the turning point? What made you reach out and say, I want to change my life?
I had a very bad experience with some Perk 30s, M30s, whatever you'd like to call them, a year ago. And it just scared me so much that I just decided that I gotta change. It's been going on so long. I spent so much money. I spent so much time. I don't know. I finally realized that myself that I wanted to stop doing this. I couldn't go on forever like this. I was going to die or end up in jail or both. So really no specific thing that I could point to, just this one it was just a scary event that I had, and then just decided to really take my treatment serious. And then I did go to an outpatient rehab, as well as started the Sublocade with Dr. Sethi.
We're glad you found her. We're glad you're doing well. We're going to get to some community questions because they're coming in for us today. So thanks for sending those in. Let's get started on those. But Kitty is asking if the health system is the only hospital in Kansas that can administer this procedure.
That is not correct. There are other clinics in I think there's one in Overland Park, and there are some private clinics that do it as well. And as long as there is a provider or a clinic that is REMS certified, it has to go through a specific certification through pharmacy. They can go ahead and administer it.
Okay, so Mary has a question, and we talked about insurance, but her comment is, since addicts usually don't have a ton of money, how is it financed? What is the cost, assuming somebody is not insured?
So that's where the University of Kansas Health System grant that we get from the state of Kansas comes into play. If you are uninsured or underinsured, you can always call our clinic. We can assess you and put you on this medication, and the grant will totally cover the medication as well as the doctor visits as well.
A question for Mary, Suboxone. Did somebody mention Suboxone earlier? Is this Suboxone? Is that an abused medication as well?
So buprenorphine, which is the generic name, and then the trade name is called Suboxone. And then this medication is called Sublocade. So this is the trade name for the injectable.
Gotcha. Okay. Dr. Hawkinson. Yeah. Okay, you're up, my friend. We do have some Omicron questions, as you can imagine. Isaac, as I've heard, Delta was rather low in South Africa, giving the new variant more room to spread. How are the dynamics different here in the U.S., where Delta is abundant?
Yeah, and I would say it's not just the U.S., it's really most areas around the globe where Delta is so prevalent and dominant. So that is the one thing, and I think that is kind of what we are all waiting to see and figure out, if Omicron can come in, outcompete Delta as far as cases and, of course, hospitalizations. And so I think that's what we were really waiting to see. Right now there are very few amount of cases of Omicron that we've detected in the United States. I just saw an article today. There were 8 cases detected at one hospital. So those cases are going up. We know that the states and the private labs are doing the sequencing to really figure that out and keep on top of Delta versus Omicron versus any other variants as well. So we have to wait to see that. Again, we know it can protect people from getting the infection, but right now Delta continues to be predominant, and we will kind of see what happens moving forward in the next couple weeks, but we are still in a significant Delta surge. However, the data and the published reports coming from the New England Journal of Medicine out of Israel that was published last night show that the people that got boosters in those booster groups, so that third dose, if you are non-immunocompromised, it has a significant effect in decreasing the chance of severe disease and hospitalization and death as well. Again, the predominant variant there was Delta at the time. We are still waiting to see further data on Omicron with immunity and vaccine-induced immunity, but it looks like the vaccines will continue to produce immunity. Probably better, though, if you've at least gotten that third dose or that booster dose.
Jennifer says she wants to give permission for her 16-year-old to get the boosters, said that her pediatrician said that that was okay. How would she go about doing that?
It's really against the EUA right now. I suspect that within time, and I don't know how many, if it'll be just a couple weeks or a few weeks, that will be moved towards that for everybody, especially that third dose, especially if we're talking 6 or 8 months after that full vaccination, because we know that with time, you continue to have better evolution of your immune response. So if you get that third dose 6 or 8 months later, you are probably going to have better evolution of your immune response, both in the B cells that create the antibodies and in the T cells. We certainly can't recommend it. It is against the emergency use authorization right now, but the fact of the matter is that really anybody can walk into any private pharmacy or commercial pharmacy and or set up an appointment to get those vaccines. So I think you'd have to really talk to your physician about that, your pediatrician.
Was that not accurate for her pediatrician to tell her that that was okay?
Again, we can't really go against the emergency use authorization in the legal sense. So.
Okay, so Gene has been
But
asking this.
would it be safe? We anticipate that these extra doses, just as we have seen with everybody 18 and above, the extra doses are safe. I would kind of recommend against it right now, but I do feel that everybody will be moving towards that third dose, and I do suspect it will be safe.
All right, just wait a tiny bit longer. Okay, Gene's been asking this question for the last couple of days, so I want to get it in. He'd still like to hear some advice on eating safely indoors at restaurants. Is that even possible right now?
I think it was more possible when we saw the rolling 7-day average of cases further down than it was. It was just under 200 at some point. It has gone up, so I think you're really looking at that more of a high risk situation when you are eating indoors, because you have to be unmasked. We know that the risk tool that is put out by Georgia Tech, looking at COVID rates around the country, specifically looking at county rates, we know you can go there and look at that that kind of risk. And right now in Johnson County, if you are in a room with 50 other people, your risk of at least one person having coronavirus infection is about 80%. So that is you have to take that into account. I think it gets more risky as the disease become more prevalent, as we see more cases around the metro area as well.
All right, Patty has a question. I just read about the stealth Omicron that PCR testing won't detect. Will the home test pick those up?
Yeah, so I think what she's referring to is on the PCR test, there are 2 or 3 PCR targets, and those are looking at specific areas in the genome. Some of the tests will have what we call an S dropout, and that was also common in Delta, I believe. So that's not unusual. It's the same type of thing. We know that our PCR test here, I've talked with Dr. Leisman in the microlab, we do not have that S dropout. The targets for our PCR are not affected by that, but certainly some are. And that is one way that they first identified Delta in the United States, and I think first identified Omicron as well. But that should not be affected by the home test. The home tests are antigen tests. So you're looking at actually a protein. You're not looking at the genome, but it should not be affected. The home test should not be affected by that.
All right, good to know. All right, we're going to wrap up our COVID questions, and anything I missed, we'll get to follow up Friday. Dr. Hawkins, you'll be here with me tomorrow, so we'll get to those. But I want to get to some final thoughts from our guests. And Dr. Thornton, I'm going to start with you as one of the people on the front lines of this epidemic, if you will, as far as opioids go. And just what are you seeing, and what do you want us to know? What advice do you have?
Well, like I said, I just think it's important that education, knowledge is a key here, and people need to understand it is in the community, how dangerous it is. Narcan is the short-term treatment, and obviously the long-term treatments are some of the things we've talked about today. But I just think knowledge is a key here, and people need to understand that fentanyl's here. It's probably here to stay for a while, and it's going to be a problem. And you got to be really cognizant of that.
We are not in a protected bubble.
Not anymore.
Dr. Sethi, you've talked about treatments today. Give us your final thoughts, what you want us to know, and also how people can reach you and reach our center and get help.
So one of my biggest thoughts that I tell all my patients these days is that even methamphetamine, cocaine, or even cannabis, any kind of drug that's out there is being laced by fentanyl. We have had a lot of patients come up fentanyl positive when they were using other drugs, and they promise they have never even seen an opiate. These are people with not even opioid use disorder. So it is very common. I've heard from other physicians as well that this is pretty common in their practices as well. So people should be mindful that if they are using any kind of drug, that it could be potentially laced with fentanyl. And having Narcan, I am trying to give Narcan to almost all my patients, whether they are opioid use disorder or any other drug use as well. So just having that, so the education is the key, number one, and then just being mindful of the fact that it could have fentanyl in it.
Okay, hold up. You just said something. So you're saying any medication that anyone takes, how do we know that it has not been touched by fentanyl? How do we know that it's safe?
When I say medication, I meant a drug.
A drug. Okay,
Yes.
you're just saying no, but that's why you don't take. That's why I mean, Doctor 101. You don't take medication that somebody else hands you out of the bottom of
Right.
their purse. You have to make sure it's come from a safe spot.
Right.
So,
But I was saying, just like people use cannabis, and in some states it's legal, so they might use just cannabis thinking that it's for their therapeutic benefit, but it might have been coming from a source that might have laced it with fentanyl.
Okay.
And being mindful of it, knowing your sources, and having a Narcan at home could be life-saving.
this is really good information because it's very scary. Our family lost two young boys to a fentanyl overdose as well. So it's a topic close to my heart, and I know some of our viewers have experienced the same losses. So definitely I'm with you, and I get it. Gary, I want to go out to you on kind of a lighter note. First of all, I have to ask you about your beard. Is that seasonal or is that normal? Is that your year-round look?
My soft, demure librarian type exterior here. I dress to blend in with a certain group of people.
Okay.
And people, I often get asked about that, but I need to be able to blend in where I'm working.
Sure. Well, facial hair is kind of in. It's in these days, so you're looking good.
So, no, but and I'll tell you, I'll add to something that was said. We are seeing a giant uptick even in marijuana. We're seeing a giant uptick as far as being laced with fentanyl. We're seeing a giant uptick of what we call trash heroin. That is what they call candy heroin now, and that's heroin that's laced with fentanyl because that way it can be a lower quality heroin. They're lacing it with fentanyl, and then in hopes that they're still able to sell the heroin, that it's still potent. So we're seeing a giant uptick in that same thing that we're finding.
It's just really interesting. I remember, the word heroin was not even a word I'd even heard of, growing up. And then when I got married, and these two young boys that are in our family were on heroin, and it was going around their high school, like it was nothing. And I had no idea. So that's why I love this conversation so much, because I think I never thought that would hit my life or be a part of my life. And I think it hits everyone in some way. It's kind of like cancer, it's 6 degrees to something. So it's real and it's here. And Gary, I appreciate your insight and kind of giving us the harsh facts and truth. Clint, I want to end with you because I'm hoping you're going to give us some really good advice. If you could talk to anyone, a parent or a friend or a spouse, colleague of someone who knows someone who was you a year ago, what advice could you give us? What do you want us to know as we head out today?
Opioid abuse there isn't one demographic. I mean, anybody can be it, from a professional to somebody on the streets and everybody in between. I don't know how to stop fentanyl use, but I do agree that education's probably the best place. I mean, once you're on it, you're really not going to change somebody's mind until something life-altering happens. But there is, I don't know about the Missouri side, but on Kansas, KU Center is there. Like Dr. Sethi mentioned, I had insurance, but I did not have good prescription coverage, and I was able to get my everything covered for $5 a month. They have a lot of options there that people can do. Reaching out, knowing who to call, how to get a hold of them. I think could be, maybe get that out more, and try to educate people, because once they're in the cycle, I think it's going to be extremely harder to probably get them out than if you could get them to not go in the cycle in the first place would be, I think, the goal.
Well, Clint, you look great. Thank you so much. We're so happy. Your recovery story is super cool, and we hope you come back and share more with us. So thank you so much, Dr.
Well, thank
Hawkinson.
you.
I'll let Dr. Hawk, I'm going to let you
Yeah.
have the final word today. Great
Yeah.
conversation, right?
Yeah, I mean, this is so important. We know that there are epidemics, pandemics on top of each other, whether it is COVID plus the opioid epidemic, which was raging even before the COVID pandemic. It's other illnesses, childhood illnesses that could take hold because the children are not getting vaccinated for things that they normally got vaccinated for, that they've been vaccinated for decades. So I think it's important to understand as well is that this continues to also be a significant pandemic, the COVID-19 pandemic, of the vaccinated versus unvaccinated. We have a graph here that was originally published in late October at the New York Times, but basically what that shows in those peaks there is that those are unvaccinated people. Those are cases on top, and then on the bottom, that's deaths. And you can see that the higher lines in both of those graphs are the unvaccinated versus the vaccinated. So it continues to be vitally important to continue to tell everybody to get their vaccination. And now it's looking like moving towards those boosters. If you haven't gotten your boosters yet, it's extremely important to go get your booster doses of the vaccine. This will also help provide protection versus Omicron from what we have heard from really preliminary studies and press releases. And we do have a picture here, and if you have children, we know that the vaccine rates in children are going down too. This is my nephew AJ, who is 6 years old. He got his second vaccine dose about a week ago. So he's doing well, didn't have any problems from that. So please get yourself vaccinated, get your booster, get your children vaccinated. Everybody in your household who is eligible, please go get vaccinated.
And we all get a sucker, just like AJ, right?
That's right,
Makes
yeah.
it all better. All right, before we go, there's another issue we need to talk about, and that is the blood shortage here in the metro area. The Community Blood Center has just a 1 to 2 day supply, says that could be wiped out any minute with any sort of major trauma event in the city. So the ideal supply is 7 days. So this is truly an emergency. If you can, please to make an appointment to donate. You can do it in 2 different ways. Call the number there on your screen, or you can go to the website savealifenow.org and make an appointment. Final thoughts. Thank you so much, everyone, for being with us today. We really appreciate it. And thank you for joining us here on Facebook and on our YouTube channel. We're going to talk about coming up tomorrow. I said Dr. Hawkinson's going to be back with us with those follow-up questions. We've also invited Dr. Amber Schmidtke to join us. She is the chair of the Division of Natural Science and Mathematics at the University of St. Mary's. Big title, but simply put, she's our super smart numbers gal, and we are so glad to have her back tomorrow as those numbers rise. We want her insight on what this could mean as we officially enter the winter months, what can be done, and how we can protect ourselves and our families. So please join us. We will see you tomorrow right here at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.